Hi ladies, and welcome to this week's 2-minute tips. We are talking today about how to best look after an episiotomy scar. So you should really treat that area very much the same as anyone who's had a vaginal delivery, but just with a little bit of extra care and caution because you've got an incision with stitches and it's going to form scar tissue. So just a little bit of extra care. So in the first couple of days, ice is really important to try and reduce pain and swelling in that area. Regular Sitz Bags are also really important. They're very easy to do, just some warm water to help that scar healing. Keep the area dry and clean as much as possible, so be very careful when going to the toilet that you spray warm water on it afterwards and then pat it dry so that it's kept nice and clean and dry to minimize any chances of infection. Make sure you avoid constipation. As always, like the plague, so you do not want to be straining on the toilet. That's going to put a lot of pressure on that healing site, and we don't want to be doing that. We want to make sure that we are doing pelvic floor exercises, but you only start these when you feel comfortable and pain-free. So you may find that that may not be for the first 3 or 4 days. That might be more like a week after birth that you feel comfortable enough to do a gentle contraction and relax, but just wait until you feel comfortable and pain-free in that area. I do not want you exercising that muscle if you've got pain on your episiotomy site. Now, further down the track, around that 6-week mark when everything is healed up properly and you're starting to consider more internal activities like maybe sex or putting a tampon in eventually when you get your period, which is all okay after the 6-week mark, that's when you may want to consider some scar tissue massage. So this is good for 3 reasons. So 1, to improve the physical flexibility in those tissues so that you don't have residual tightness. 2, to desensitize, or actually resensitize, I should say, the nerves in that area. So we want to reintroduce sensation because it can be quite numb along that scar line. So it's good to start touching it again and reintroducing sensation, and that will help the nerve healing. And 3 is because it's really important to reconnect back to your vulva and your pelvic floor after birth for everyone, but particularly if you've had an episiotomy, because this may carry a little bit of baggage for some women. You may feel a little bit like that's a no-go zone. You don't want to touch it. It feels funny. You may have a little bit of trauma from it, whatever it might be. But when you're feeling up for it, it is good to start touching and massaging that area again so that you can get the brain and the pelvic floor and the vulva to reconnect and spiritually to reconnect back to that area so that you welcome it again and you get to know it and you get to know the new version of it with a scar there now so that it doesn't carry any baggage for you. That's really important as well. So you can just use your favorite lubricant or organic oil and you just do gentle circular massage along that scar line just for a couple of minutes, and you can do it every few days as long as it feels comfortable. So I hope that helps.